Now, when a patient has very extensive hair loss, when the hair on the sides has dropped low, we face a particular challenge. If we place the front of the hairline correctly and then connect that with the side down here, it doesn't look right. So rather, we need to elevate the sides first and then connect them to the hairline, and we call these parietal humps. And surgeons all over the world know this technique. What many do not know is that they should be called Shapiro humps. Since, Ron, you were the first surgeon in the world to properly identify the problem and arrive at the elegant solution. Ron, what happens if parietal humps are not used?
Well, obviously, if the parietal humps are not used, people tend to make the connection too low, and it looks like a ring around the hairline. It doesn't look right. The thing about that, this is the way I visualized it, is I started looking at people going bald and seeing what happened. People lose the hair here. They get recession. What are they left with? They're left with a frontal, like Biener's frontal forelock. They're left with this frontal tuft. You see people like that. So when you start observing people, and then you see people, they lose the crown. They're left with a bridge across the top, and that bridge is the mid part, and it's connected to these lateral humps. So this is the way people lose their hair. They lose the crown, they lose this, but a natural look, I call it the Bruce Willis look, the Sting look, Phil Collins look. Who's that guy that played James Bond? You know, they all have Jude Law. It's not maybe a young hairline, but it's natural. This is one of the first things that came out. It's a natural look that exists in nature. And what it showed me was that the central density is always greater than the lateral density. The central density is always greater because that's what's left, and then you lose it here and there. And so it made sense that when you put hair back, you follow that same thing in reverse. So this part here always has to be greater than that. So what happens is when people aren't going to have enough hair, they're going to lose. When people go from a 6 to a 7, you're not sure. I mean, you know you can pretty much for sure recreate the lateral humps, recreate the bridge, and do that. They have enough. That's going to look natural. And then if they have enough hair, you can start to then go further forward and go down to, it really depends on the donor and their age. That sort of conceptualization, and this is all it is, a conceptualization, helps you plan somebody based on their age. And so you always imagine those lateral humps because that's the safest, you know if you plan on connecting up to the lateral humps, you can't go wrong. And then if they have enough hair, you can get more aggressive. So it's figuring this out. How do you do that? So that was sort of my conceptualization.
And I think something you said at the very beginning is the crux. Is you paid attention, you watched, you observed what happens in nature. And I'm struck by, again, people who are cosmetic surgeons who don't always look at the natural hairline. There's all sorts of different things. And when I'm a dermatologist, when I'm doing a skin exam on someone, I'm looking at their hairline. I want to see all the different variants of their hairline. If you see it going in one direction, it makes it easier to make it aesthetic going in the other direction. But unfortunately, not everybody pays attention adequately.
Well, so I think is that people always knew that the hairline should be soft, should be irregular, but they didn't pay attention on what that really meant, and so I think the visualization of it, or they've paid attention, but the visual and the conceptualization, I think I just put into words what other people were seeing and made it easier for them to, oh yeah, I see that. And then they could do it. I think that's sort of the thing, how do you make the hairline irregular? Well, it's really a variable in density, and I created my way. But other people did it their way. It was just creating the same thing, but realizing different ways of visualizing it. So when I do teach my hairline, I do say this is not the only way to do it, but this is the principle, and then you try to do the same thing.
You think after 30 years of teaching this, it would have been picked up. It would be just natural. But the problem today, I was going to get to is the black market.